I'm a fellowship-trained breast surgical oncologist. I'm Dr. Amani Jambakar, and let's talk about Paget's disease of the nipple. This is a picture of it. Paget's disease of the nipple means that there are cancer cells that are actually in the lymphatics, in the dermis, or a layer of the skin itself. So oftentimes it presents with things like nipple itching, as well as scaling and a crusty rash, and sometimes just really subtle skin changes, which make one nipple look different from the other. And here are some other photos of Paget's disease of the nipple. There are a lot of different ways it can look, and sometimes it can be as subtle as the one at the top here, where there's just a little red spot on the nipple that the other nipple doesn't have. It can also be as dramatic as this one right behind me. You can see that the entire nipple is crusted and scaly in that circumstance. A lot of these patients get referred to dermatology first because it looks like a rash and oftentimes it itches like a rash. And the dermatologist may do a skin punch biopsy, which then shows Paget's disease of the nipple. The takeaway is that if you are having itching of the nipple and then you're starting to have any skin changes, it does need to be evaluated with a biopsy because you don't want to miss something like Paget's disease of the nipple, which typically doesn't really show up on a mammogram or an ultrasound and just shows up in the skin.